So here we are in the center of the house, or the inpatient unit. We've got 3 nutrition centers for patients to use for snacks and things. We've got relaxation rooms. We've got lots of amenities for our patients. Nice socializing space in this area as well.
We were really trying to make this place almost like the living room of a house. So there's lots of comfortable seating around here. Again, we've introduced natural light into this space so that it has a pleasant feel and views to the outside. And as you indicated, each one of the corridors that's around here has its own smaller little kitchenette and lounge as well. So this is kind of the major social interaction space, and then each one of the pods has its own space as well. One of the key things that we were trying to do in here is make sure that the visibility was very good. So the care station that we have behind us is canted out into the middle, so you have visibility from that care station down each one of the corridors, plus into this living room space, and then there's smaller lounges that are in behind here as well. And so it was really important from a safety and security point of view to make sure that those opportunities were provided to you in a kind of a subtle manner without making it too overpowering that we're sort of looking over things here. In the corridor here, we've tried to bring a lot of natural light in to reduce that kind of length of corridor. So along here you can see the windows that have views into the dining room and out into the therapeutic courtyard outside. We tried to use some focus colors at the important features within the inpatient unit. So the dining room is a kind of larger social interaction space. And we wanted to really focus on that. So when you're looking up and down the corridor, you can kind of see, okay, that's the entrance in. And then we did something that's kind of fun on the glass on behind. We have put photographs from the original facility of the kitchens in that hospital, just to kind of bring some of the history into this unit.
Yeah, it's a very nice idea. People love it when they see it. Celebrate the history and bring it into our new space. Why don't we go into the dining room and enjoy the environment there?
Absolutely. So here you can see one of the dining rooms, and with a great view out into the therapeutic courtyard.
We've tried to keep that multi-use idea throughout the building, so we'll also use it for activities where we want people to get together and enjoy themselves in a nice environment.
You can see in the dining room here we've put windows along the whole wall to really bring a lot of natural light into this space, and then let that kind of flow out into the corridor as well as one of those special spaces within the inpatient unit. One of the other things we did was introduce color to differentiate the 8-bed pod. So you can see over top of the doorway down here, there's a bright colored bulkhead, but it's a different color than this one here. So again, we're just reinforcing the differentiation between those pods. Each one of the inpatient units has access on the level to a therapeutic courtyard area. They provide opportunity to get outside, get some fresh air. You've got great views from a lot of the rooms. They're almost kind of like looking out in your backyard, but they're well landscaped. But they also provide a great space for social interaction. Each one of the inpatient units has a porch on it as well, so that people can get outside in a smaller, more protected environment.
Well, I think for those people that need to stay close and need to stay safe a little more than others perhaps, and still have the opportunity of fresh air without, again, like you say, going into the bigger spaces.
So there are 8 beds along each one of the pods here. Most of the standard rooms have the patient space. They're all single rooms. They have their own washroom in them.
So there's a bariatric room, so for people that are over 300 pounds that need those kind of special lifts and things. And there's a room where if we have someone we need to keep a close observation on, we have a window in the door that allows us to do that, but with privacy also factored in. And we have a negative pressure room, so that was mandated by the ministry. If we ever have another SARS or something similar, then we'll be able to contain things in a way that we have to.
Each one of those have an ante-room associated with them and special air handling systems to make sure that that protects any of the staff or other patients within the unit.
All right, so had a nice look at the inpatient unit. Maybe we should look at our research area in the adolescent psychiatry inpatient unit.
Great.